Assalamualaikum and a very good day to Dr. Mimi. My name is Muhammad Harizania bin Muhammad Shamsul Badri and my student ID is 20211-26297. We are from Group The Anchors presenting a case study regarding the BOSEMAN'S cancer. As the first presenter, I'm going to be presenting about Chadwick Boseman cancer and also about the colon. So before we get into the case study, the case study question is Boseman's cancer had reflected a lot of people, especially African American community, into becoming an awareness among them. So why has it become an issue? And why does the African American community has to be alerted? Here we are addressing the issue. First off, who is Chadwick Boseman? He was a globally known actor whom you may know as the Black Panther. Boseman was an African American who detected the colorectal cancer at the age of 39 when he was in stage 3 of the cancer and died at 43 as he battled with the cancer for 4 years. Before we know more about the colorectal cancer, let me briefly explain to you about what is cancer. So cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. When it spreads, it is called metastasis. In metastasis, cancer cells break away from where they first formed, travel through the blood or the lymph system and form new tumors in the other parts of the body. When these new tumors form, they are made of the same kind of cancer as the original tumor. Cancer cells can hide from the immune system. These cancer cells could also influence healthy cells, blood vessels, and molecules that nourish and surround tumors. As an example, cancer cells can make normal cells produce blood vessels to supply the tumor's oxygen and nutrient needs in order for them to grow. Also, chunks of cancerous tumors can also break off and travel throughout the body in the blood or the lymph system, forming new tumors in different locations in the body. Cancer cells or tumors in organs or the bloodstream can disrupt organ functions. They destroy healthy cells in organs, block their nutrients and oxygen supply, and allow waste products to build up. If cancer becomes severe enough that it prevents the vital organ functions, it can result in death. There are also 4 stages in cancer. In stage 0, the tumors are where they originally developed. They haven't spread and highly curable, while in stage 1 is the early stage of cancer. The tumors are small and not deeply embedded in surrounding tissues. They haven't spread to other parts of the body or lymph system. In stage 2 or 3, tumors tend to be larger and have grown deeply into the surrounding tissues. They may have also spread to other parts of the body. This is the stage where Boseman was diagnosed in. Lastly, stage 4 is called metastatic or advanced, which means they have spread to other parts of the body. Next up is colon. It is also called as the large intestine. Its major function is to recover water that has entered the alimentary canal. The wastes of the digestive tract, which is feces, become more solid as they move through the colon of the digestive tract. Those feces pass through the rectum and exit via the anus. The colon houses various strains of the bacterium E. coli. For the next part, I'm passing it to the next presenter, who is Nur Shahidatul Shahira.
Colorectal cancer is a disease where cells in the colon or rectum grow out of control. Sometimes abnormal growth called polyps form in the colon or rectum. Over time, some polyps may turn into cancer. Sometimes called colon cancer for short, colon for large intestine or large bowel, and rectum passageway that connect colon to the anus. Third most common cause of cancer diagnosed worldwide is third in men and second in women. Colorectal polyps. Colorectal cancer most often begins as a polyps, a non-cancerous growth that may develop on the inner wall of the colon or rectum as one gets older. If not treated or removed, polyps can become a potentially life-threatening cancer. Edematous polyps or adenomas grow that may become cancerous and can be found with a colonoscopy. Next is how colorectal cancer starts. It begins when healthy cells in the lining of the colon or rectum change and grow out of control, forming a mass called a tumor. There are two types of tumor, which is first one is cancerous. Cancerous is malignant, meaning it can grow and spread to other parts of the body. And the second is benign, meaning that the tumor can grow but won't spread. Changes usually take years to develop and months for those who have genetic syndrome or inherit from their families. Both are genetic and environmental factors can cause the change.
Assalamualaikum, my name is Pengiran Anik Afif bin Awangku alias. My student ID is 20211116801. I will continue the presentation from here. I will begin with the risk factors. In general, the risk of getting colorectal cancer increases as you grow old. Other than that is genetic syndrome such as familial adenomatous polyposis, FAP, which is an inherited disorder characterized by cancer of the large intestine, or hereditary non-polyposis colorectal cancer, which is also known as Lynch syndrome. Lynch syndrome is due to inherited changes, which is mutations in genes that affect DNA mismatch repair. Next is inflammatory bowel disease, IBD, which is a term that describes conditions characterized by chronic inflammation of the gastrointestinal tract, such as Crohn's disease and ulcerative colitis. Moreover, the risk of getting colorectal cancer differ by ethnicity, which is the rates being 20% higher in African American than non-Hispanic whites. Rate of death in African American is higher, which is at 40%. Finally is overweight and obesity. Next is lifestyle factors. The first one is the lack of regular physical activity. Physically inactive people tend to get sick more than people who are physically active. Next is tobacco use. Tobacco doesn't only cause cancer on your lungs, but almost everywhere in your body, which includes colon and rectum. After that is the small intake of fruit and vegetables daily. Not just that, drinking alcohol can also cause cancer, which is mouth, throat, voice box, esophagus, colon and rectum, liver, and breast in women. Final one is a low fiber and high fat diet, or a diet high in processed meats. Okay, now I will be presenting about the symptoms. The symptoms can be very unspecific, but some of the symptoms are fatigue, which is feeling of lacking energy, bloating, which is caused by too much gas clogging the gastrointestinal tract, rectal bleeding that is often misdiagnosed as hemorrhoids. It is different with hemorrhoids because rectal bleeding, the caused by cancer, usually continues or worsens. Furthermore, new constipation is also the symptoms of colorectal cancer. Besides that, patient might face unexplained weight loss due to the colorectal cancer because of the change of appetite, which includes loss of appetite and poor appetite. The last one is persistent abdominal discomfort, cramps, gas, and pains.
My name is Nur Afika Hanem binti Azlan. My student ID is 2021105251. I'm going to continue the presentation with the prevention for colorectal cancer. Firstly, make an annual fecal occult blood test (FOBT) plus flexible sigmoidoscopy every 5 years. The second way to prevent the colorectal cancer is to make CT colonography every 5 years. Next, do the colonoscopy every 10 years. After that, we need to do double construct barium enema every 5 years. The fifth one is to limiting the alcohol consumption. Several studies have found a higher rate of colorectal cancer with increased alcohol intake, especially among the men. It is the best to not drink the alcohol. For people who do drink, they should have no more than 1 drink per day for women or 2 drinks per day for men. Not drinking alcohol may also help you to reduce your rates for getting the colorectal cancer. Next, we should have a healthy lifestyle, which is healthy eating and do exercising for at least 2 or 3 times a week. Overall diet that are higher in vegetables, fruits and whole grains and low in red and processed meat probably lower the colorectal cancer rates. And lastly, colorectal cancer can be prevented by quit smoking. Recent studies have shown that smokers are more likely to die from colorectal cancer than non-smokers. Long-term smoking is linked to an increased risk of colorectal cancer, as many as the cancers and health problems. Quitting smoking may help lower your risk of colorectal cancer. Next, I will continue my presentation with the treatment. The first one is having a surgery. Surgical resection is the removal of the tumor, some surrounding healthy tissue and nearby lymph nodes. Some patients may be able to have laparoscopic colorectal cancer surgery. The incisions are smaller and the recovery time is often shorter than the standard colon surgery. Laparoscopic surgery is as effective as conventional colon surgery in removing the cancer. Less often, a person with rectal cancer may need to have a colostomy. Sometimes, the colostomy is temporary to allow the rectum to heal, but it may be permanent. With the modern surgical technique and the use of chemoradiation before surgery, most people who receive treatment for rectal cancer do not need a permanent colostomy. The second one is to undergo radiation therapy. For rectal cancer, radiation therapy may be used before surgery, called neoadjuvant therapy, to shrink the tumor so that it is easier to remove. It may also be used after surgery to restore any remaining cancer cells. Then the colorectal cancer can be treated by chemotherapy. Chemotherapy is usually used to stopping the cancer cells' ability to grow and divide. Chemotherapy may be given after the surgery to eliminate any remaining cancer cells. For some people with rectal cancer, chemotherapy is given with radiation therapy before the surgery to reduce the size of the rectal tumor and reduce the chance of the cancer returning. Colorectal cancer also can be cured by targeted therapy. Targeted therapy is a therapy treatment that target the cancer-specific genes, proteins, or the tissue environments that contribute to cancer growth and survival. This type of treatment blocks the growth and the spread of the cancer cells while limiting the damage to the healthy cells. After that, the treatment for colorectal cancer is anti-angiogenesis therapy. Anti-angiogenesis therapy is a type of targeted therapy that is focused on stopping angiogenesis, which is the process of making the new blood cells vessel. Because The tumors need the nutrients delivered by the blood vessel to grow and spread. The goal of anti-angiogenesis therapies is to starve the tumor. In 2004, the FDA have approved the first anti-angiogenesis monoclonal antibody along with the chemotherapy as the first-line treatment for advanced colorectal cancer. An oral anti-angiogenesis tyrosine kinase inhibitor was approved in 2012 for patients with metastatic colorectal cancer who have already received a certain type of chemotherapy and other targeted therapies. Subsequently, newer anti-angiogenesis monoclonal antibodies combined with the chemotherapy in the second line setting for metastatic colon cancer. These all were approved by the US FDA. The last treatment for colorectal cancer is epidermal growth factor receptor (EGFR). Epidermal growth factor reception inhibitors are a type of targeted therapy that stop or slow the growth of the colorectal cancer. Currently, 2 FDA-approved EGFR monoclonal antibodies are recommended for their only use in patients with the tumor that express non-mutated or wild-type RAS genes. As a group, we conclude that the Black community has a higher rate of death and getting this particular cancer. BOSEMAN'S death has opened the eye of all the age to get checked out annually, as Boseman himself was an active man, healthy, but also get the cancer. And this is all our reference. Thank you.